Dr. Anthony Fauci. He is a member of President Trump's coronavirus task force and director of the National Institute of Allergy and Infectious Disease. He joins us now from Bethesda, Maryland. Thanks so much for speaking to us. There really is international panic now about this virus, but put into perspective and the fact that, your average flu kills thousands of people every year in many countries. Do you think the coronavirus is really that dangerous?
One of the things that I think it's important to point out is that this is an evolving situation in which we really don't know what is going to happen. In other words, how much it's going to accelerate. It's been accelerating, particularly in China. But you're absolutely correct. One of the things that we've learned with outbreak observation is that a real danger that you know of, even though it's a serious danger, like we're in the middle of a seasonal flu this year, which in the United States has killed about 10,000 people and has had well over 100,000 hospitalizations. And people generally understand it and take it casually. It's the fear of the unknown which causes the panic that you're talking about. So right now, there's a serious situation in China. Will this turn into a global outbreak of the extent to which you see in China? We don't know that. I think the public health measures that people are taking in different countries as travel-related cases come in to identify, to isolate, and to do contact tracing in many places, including the United States, has prevented there from being an outbreak. Whether or not we're able to control this until this outbreak dies down naturally is unclear. But I think when people see on television what's going on in China, the somewhat almost chaos that's going on there and fear, then what happens is that they extrapolate that to themselves in their own country.
Right.
I think that would be premature. But right now, for example, in the United States, although we take this very seriously, because the Chinese, unfortunately, are really suffering from this, in the United States, the risk is still low, but it might change. And that's the point. We've got to be careful that we're not too casual about it because the risk can change.
Right. We have to get the right balance. But okay, as far as prevention is concerned, the fact that China has built a hospital in 8 days and another is almost complete from what we're hearing, does it give you confidence, really, that all measures are being taken to contain this virus?
Well, it depends. When you say all measures, you mean in China? Well, China is doing things that are really quite draconian and dramatic. For example, as you probably know, they have shut down the travel and the ability to move freely of about 55 million people, including the entire 11 million people city of Wuhan. That is something that really is somewhat unprecedented in any way in epidemic control. So they are being very aggressive now. They were a little bit slow in the beginning, but right now they're being quite aggressive.
Do you welcome that aggressive approach?
Well, I think they really feel they have no choice because of how it's accelerating in China. And that's one of the things that I think we need to just give them the benefit of the doubt, that what they're doing right now is something that is appropriate in order to contain the spread of the virus.
Okay. Doctor, we're going to leave it there. Thank you so much, really, for joining us from Bethesda. We greatly appreciate it.